It's that time of year again. Open enrollment is here, and it's time to consider what benefit options are best for you and your family members. Open enrollment is your annual opportunity to review and make benefit elections for the upcoming year outside of a qualifying life event. This presentation has useful tips and information to help you make the right elections for the upcoming plan year. Let's get started. Before we go into greater detail about each benefit, make sure you've marked your calendar with these important dates. Remember, outside of open enrollment, you may not make changes to your election unless you experience a qualifying life event, so be sure to note these dates and take action by the deadlines. You are required to make new elections for 2025 in the following categories: FSA, commuter benefits, and all additional supplemental coverages as they do not roll over year to year. Medical and dental coverages will automatically roll over unless otherwise opted in the app. Once open enrollment is complete, your new benefits will become effective on January 1st. Be sure to check your first paycheck after January 1st to ensure accurate payroll deductions for your benefits. Before we get started, we wanted to review some common insurance terms. A deductible is the amount you will pay each year before your plan begins to pay for healthcare costs. A copay is a preset amount you pay for your covered healthcare services. Coinsurance is the share of the cost of your covered services that you have to pay. Out-of-pocket maximum is the most you will pay in a plan year for healthcare services. Once this amount is met, your plan will cover all other covered services at 100%. In-network refers to a system of healthcare providers and facilities that have a contract in place with UMR to provide you services at a discount. Out-of-network refers to providers and facilities who do not participate in the network. These providers are often a higher cost, do not provide a UMR discount, and may not be covered at all depending on the plan you choose. Let's get into more details on the medical plans available to you. Premio offers hourly employees 2 EPO plans to choose from. EPO plans are traditional plans with copays, but no coverage for out-of-network services. Under the EPO plan, you will need to check that your providers and facilities are in-network every time you receive services. Instructions to search for in-network providers can be found in your enrollment guide. Out-of-network services are not covered under this plan and will be your responsibility. Preventive care is covered at 100%. There will be no changes to benefits or rates for 2025. Visit umr.com on your desktop computer or download the UMR mobile app to access your medical information. View or print your ID card on the go. Get updates about your claims and benefits details so you can stay informed about your coverage. Stay on top of your health expenses with easy access to your account balances anytime, anywhere. Search for in-network providers to get the care you need when you need it. Get assistance through email, call, or chat with UMR to get answers to your benefits questions 24/7. Go to umr.com to find a doctor near you. Select Find a Provider on umr.com or select Find Care on the UMR app. Select the UHC Choice Plus network. You can locate providers using the alphabetical listing or by typing your provider's name in the search box. It is very important to check that your provider is in network to get the lowest cost for services. As an alternate way to seek medical care, you have access to telemedicine benefits via phone, website, or mobile app for non-emergency medical assistance with Teladoc. Use this benefit for minor conditions and common illnesses such as allergies, sinus infections, and rashes. When the physician is unavailable and cannot be seen in a timely manner, when your schedule doesn't permit traveling to see your physician, work, etc., or when you're on vacation. Get started by going online or calling today. Prior authorization is required for certain procedures. Often, the provider will authorize for you, but it is ultimately your responsibility to make sure it is done. Please contact UMR to make sure the pre-cert has been completed. Failure to have your procedure pre-authorized will result in a prior authorization penalty of $250. For the most current list of covered medications, or if you have questions, call the number on your member ID card, visit your plan's website on your member ID card, or log on to the Optum Rx app to find a participating retail pharmacy by zip code, look up possible lower-cost medication alternatives, compare medication pricing and options, view step therapy and prior authorization disruption details, or request a free meter. We are pleased to offer you several opportunities to save money, both now and for future use. These benefits are moving from American Benefits Group to CAS on January 1st, 2025. Flexible spending accounts allow you to pay for your non-reimbursed healthcare and eligible daycare expenses with tax-free dollars. There are two types of flexible spending accounts, medical and dependent care. You may participate in one or both. This account is use it or lose it, so you only want to put in there what you know you will spend. You must enroll in the FSA every plan year. Premio is also offering commuter benefits. This is a tax-free election for parking benefits, transit benefits, van pool, and bicycle commuting. Because of the tax advantages of these accounts, the IRS sets limits on the amount you can contribute every year. Be sure to note these maximums as they are updated annually. Employees currently enrolled in the FSA will receive details on the transition to the new vendor with new debit cards. In addition to protecting your smile, dental insurance helps pay for dental care and includes regular checkups, cleanings, and x-rays. Premio offers a dental plan through Cigna. There are no plan changes for 2025. Preventive services like cleanings and x-rays are covered at 100% and not subject to the deductible. This plan includes a $750 calendar year maximum and coverage for basic services. Unlike in a medical plan, a dental plan maximum is the maximum amount the plan will contribute towards your annual dental care. After you reach this limit, you will be paying for all your dental expenses until the limit resets the following plan year. Premio pays a large portion of the premium for you. You will see a small increase in your payroll deductions for 2025. You have the option to purchase additional coverage for yourself, your spouse, or your dependents through payroll deduction. You can purchase up to $500,000 on yourself, $250,000 on your spouse, and up to $10,000 on your children. You must purchase coverage on yourself in order to purchase coverage on a spouse or child. Spouse coverage is limited to one-half of what you have purchased on yourself. This means that if you purchase $50,000 on yourself, you can only get $25,000 on your spouse. Newly hired employees can purchase up to $200,000 of employee life, $50,000 of spouse life, and $10,000 child life without answering medical questions. If you are no longer a new hire and waived coverage at your initial enrollment, you will be required to complete evidence of insurability for any amount of life insurance you choose to elect. As you consider your life insurance needs, please make sure your beneficiaries are also updated. Keep this information current throughout the year if you experience a life event such as a birth, marriage, or divorce. See your enrollment guide for more details. Beginning January 1st, 2025, Premio will offer hourly employees income protection for regular expense items, which are typically covered by your paycheck. If you experience a disability that impacts your ability to work and earn a paycheck, disability insurance helps cover the gap. This coverage is available to you through Allstate based on your age and salary through payroll deduction. You will be able to see the cost of coverage in your ADP portal during open enrollment. In the event you become disabled from a non-work-related injury or sickness, disability income benefits will provide a partial replacement of lost income. You will have the option to choose a monthly benefit from $400 to $5,000, not to exceed 60% of your pre-disability earnings. Benefits begin after 14 calendar days following an accident or illness. Choose between a 3-month and 6-month duration of benefits. This means that you will receive a benefit check while out on disability for as long as your doctor says you will be out of work up to the maximum benefit of 3 or 6 months. This coverage includes a pregnancy benefit. Pregnancy or childbirth will be covered the same as any other covered sickness if the employee meets the definition of total disability and if conception occurs at least 30 days after the effective date of coverage. Complications of pregnancy are treated like any other sickness and are not subject to this probationary period. While this coverage is offered on a guarantee issue basis, a pre-existing limitation applies. See your enrollment guide for more details. Beginning January 1st, Premio will now offer additional worksite benefits to fill in the gaps where you may need additional protection. If you, your spouse, or child has a covered accident, like a fall from a bicycle that requires medical attention, accident insurance provides cash benefits directly to you to offset these costs. Critical illness insurance provides a lump sum cash benefit upon diagnosis of a specified disease like a heart attack, stroke, or cancer. Help protect your finances when you, your spouse, or child are facing a hospital stay with hospital indemnity coverage and receive a benefit to help pay unexpected expenses not covered by your plan. These policies are available on a guaranteed issue basis with no medical questions asked. See your enrollment guide for more details on these benefits. There are several supplemental coverages that are available to Premio employees. If you would like to enroll or change your supplemental coverage, there are enrollment links and more details provided in your enrollment guide. This coverage is not enrolled on the ADP portal. New for 2025, Premio Foods has partnered with Smart Connect, a no-cost Medicare advocacy program. This service is available to anyone 64.5 or older or otherwise eligible for Medicare, including your family members. Learn about Medicare from a trusted industry professional. A licensed insurance agent will help you compare the costs and benefits of Medicare against your current coverage, even if you're not covered by the Premio Health Plan or already have Medicare. If you find a Medicare plan that meets your needs, Smart Connect helps you enroll immediately. There is no cost to employees to use this benefit. See your enrollment guide for more details. Premio wants to ensure you and your family have access to the best employee discounts on everything from electronics to live concerts, flights, and much more. Our partnership with Working Advantage will provide you with exclusive savings. This is a free benefit provided at no cost to Premio employees. We will be providing details soon on how to access this benefit. We understand that the world of benefits can be confusing, so be sure to utilize these benefit contacts listed in the presentation and in your enrollment guide. Use these resources during open enrollment and throughout the year to help you with your benefits. Keep this information handy to reference whenever you need assistance. For personalized assistance, our new benefits partner, Palmer & Kay, provides access to the Benefit Butler as your personal navigator for benefit issues and questions. Contact the Benefit Butler via phone or email during regular business hours for expert consultations about claims, coverage, and anything benefits related. This service is provided at no cost to all employees. Now that we've reviewed your benefits for the upcoming plan year, make sure you complete the open enrollment checklist. First, understand your benefit options by reviewing the 2025 Benefits Guide. Be sure to use your benefits contacts to seek help and ask questions. Next, make elections about which benefits you'll elect for the upcoming year. Process your elections by enrolling on ADP to ensure you have the appropriate benefits. Lastly, make sure you confirm your payroll deductions are accurate on the first paycheck after January 1st. We appreciate your time and hope we've provided you with the resources you need to make informed benefit decisions. Please reach out if you have questions.